My name's Colleen. I live down here in beautiful Sarasota, Florida. And I have been a patient of Dr. Ernst for the last 3 months. 6 months ago, I was really feeling a certain doom about the future. I'm 57 years old. I should be pretty healthy, but why would a healthy person feel so horrible? I had such fatigue, 10 hours of sleep in a night, get up and just want to lay down, take a nap. I mean, why would I be so fatigued? I have been on thyroid medication for well over 10 years, maybe 15 years. Heart palpitations, terrible, until I was really frightened. I thought, I'm going to have a stroke here, and I needed help. But I knew the only help that I knew to get was from my physician. And I thought, that's going to lead to the 3 Ps, pills, procedures, and poverty. And I thought, and you know what, and pain. As fate would have it, the hand of God, my girlfriend from the Charlotte area sent me a YouTube video for another friend with diabetes, but it was a talk by Dr. Ernst, maybe like the one that you're at today. So the first thing he did was send me to go to the lab after I told him my problems. He said, well, now let's look at what's really going on inside. And so I've got a 5-page blood workup here. And when I went to the lab, the young lady was getting me ready and I didn't know what I was doing there. So I said, what kind of tests am I getting today? And she looked at it and she said, the works. This told him from inside what I was telling him from outside. And he knew exactly how to address it. My total cholesterol went down 40 points in the last 3 months. I'm really thrilled with these results, and it's kind of proof. So I guess the thing I'd like to say to you is that he can help you. I just am so pleased with the vitality I feel right now. And then when I get this second report back, he's like, okay, we've done really good here, but let's switch it up. We're going to do this little thing. It's tailored just to you. So one final discovery I have found through working with Dr. Ernst is that old-fashioned relationship with my physician that I wanted. And I think he can do that for you if you want to make that commitment. So it is a lifestyle change, but it's worth it. It's worth it.
So does anybody here where she lives? Sarasota, Florida. How many of you would be like, wow, that's a long way to go to come up to Charlotte to get tested? Anybody? Let's be honest, seriously. So if you lived in Florida and I'm in Charlotte and I said, hey, I can help you, you just need to get some tests done, come up here, see what happens. Right? It's a long distance, yes? No, I think I'm out. Maybe I'm back. We'll see what happens. We may change the mic out. I got this brand new microphone, it's supposed to be all fancy dancy, and it doesn't work! $250 for this microphone, it doesn't work. It's working right now, though. Florida, right? So I have patients in Texas, New Mexico, California. Charlotte is my home base. So you guys are really privileged because you can, in 20, 30, 40 minutes, come here, right? And she was modest on that. And I've learned something when I usually talk to somebody and share. They're like Joan, right? Oh, I love Dr. Ernst, he's so great, I feel so good. Yeah, but Joan, you no longer have diabetes. Yeah, that's great, but I feel so good, right? So she didn't share with you the fact that she's an autoimmune thyroid patient, and I'm going to teach you guys this, thyroid peroxidase antibodies. Does anybody know about autoimmune thyroid, just out of curiosity? No? So we got to talk about that today. And her doctor told her there is no cure for this. You cannot fix this. You're going to need to be on medications for the rest of your life. Her antibody score was 1,050. I'm going to tell you right now, okay, your antibody should be 0 against your thyroid. Because an antibody is your immune system attacking something. If you have thyroid antibodies, your immune system is attacking your thyroid. She has 1,050 thyroid antibodies. It can be as high as 34 before a medical doctor starts freaking out. But 1,050. And nobody told her what was causing her thyroid issues. Okay, I'm going to have them switch this out. When you look at her pre-test and now her post-test, 555. That's a 50% improvement in thyroid antibodies. Is that like praise Jesus, hallelujah, amen?
Yes.
Okay? And she's off of her medications, which if you look, she had low T3, low reverse T3, she had all this other stuff going on, antibodies like crazy, vitamin D is really low. Now normal TSH, normal T4, normal T3, normal T everything, and 50% reduction in her antibodies. In how many months?
Great.
That's insane. It's because your body has the power to do that. I don't give a medication that makes it do that. I'm going to need some sort of a clip. I don't give a medication that makes that happen. I don't say, like you're going to have to try this supplement. I make your body heal by itself by you becoming your own doctor. Who would like to become their own doctor and heal themselves? 5, 7, 10, 15 of you. Okay, great. We're getting there, right? This never happens. It never happens medically. I'm yelling so that the microphones can pick us up on the cameras. So hey, turn around real quick, everybody. See that little camera right there? It's got a little red lens on it. Can we all wave to it? That's our Facebook crew. Yeah! On average, we have anywhere between 500 to 1,000 people watching us all across the United States because we live stream this. So yay, hey Facebook. But it's like, come on, right? This is massive. So if you're here today and you're like, I was her. I was tired all the time, I was achy, fatigued, I had all these issues, and my doctor said, take this medication, you're going to get better on it, and then you never feel the improvements. It's because we're not going to talk about how to cover up your symptoms today. We're going to talk about how you can heal yourself. Does that sound fair? Mm-hmm. So with that, I want to go through a little bit of the why are you here today? You guys see the emails we sent out out of curiosity? And I said something like, hey, I'd love to custom tailor this to you. Please hit reply and let me know what you want to hear about. Who saw the email at least, right? A few of you did, right? So what I did was I sent this thing out. I sent out probably 100 emails, which, by the way, we had over 100 tickets for today. We had 55-something people confirmed saying they're coming. And here you guys are. So give yourselves a round of applause for showing up. I'm kind of delaying so I can figure out how to get this guy to attach, right? Because we got the old paperclip thing for today.
We'll just go like this. It's an extra tie clip.
Is that cool?
Yeah.
It doesn't look beautiful. We got wires all over the place. But,
As long as it works.
as long as you can hear me, right? That's the key. Let's see if this works. Can I go behind? Whoa. That's not that bad. Okay, so here's what some of you told me, okay? I picked the ones that, Hey doc, I have severe fatigue, severe sweating on my head, diabetes, heart disease, I'm sleepy all the time, foggy brained, I have no concentration. By the way, I'm only 52, lots of issues, please help. Maybe you're here today. I've been on Synthroid for 8 years. I cannot lose any weight. I've tried reducing calorie intakes, and despite all my diets and workouts, I'm gaining weight. Why? Anybody? Dr. Ernst, I've been diagnosed, I'll ask you in a second. I've been diagnosed with hypothyroidism. I currently take levothyroxine 100 micrograms. That's really high. I've been doing it for years. I want to get off this medication. Another one. How can I determine what kind of thyroid issue I have? And if I have it, how do I fix it? And what can I do to feel better? Another one. Doc, thyroid, diabetes, prostate issues, please help. Another one. Nothing is working. How do I lose weight? Another one. Is there hope if my thyroid's been removed and what's left is underdeveloped? Another one. Why am I tired all the time? Another one. I have always been told there's no cure for hypothyroidism. But then I heard your commercial. I'm interested. Hopefully you're here. I have high thyroid, high cholesterol, and I would love to not take medication anymore. Last one. Massive high blood pressure, stress issues, heart disease, thyroid issues, weight loss. Please help. Please help. I get over 100 emails every couple of days because I do a radio show here in Charlotte. Who's heard my radio show by chance? Okay? And I'm always on that show going like, hey, look, if you want some help, it's free. Click contact me, shoot me an email. Literally, I answer people's questions. I go, you know what? I would try this and do this and do this and do this. I've even had people tell me like, I did what you said. I lost 36 pounds. I'm off 2 medications. I've never even physically seen you. Because you have the ability to heal yourself. So any others, now that is what I designed today for. Is that okay? Like that should take us maybe 12 and a half hours to hit all of those. But like, is there something that I didn't say that you're like, wait, please add? Can somebody tell me? Is there something that you're here going, no, I didn't hear my problem? It doesn't have to be. Oh, we're really, really quiet. Hey, look, okay, turn to your neighbor. If they're not wearing green, like pinch them real hard. Wake them up. Wake them up. Like, real hard. Who doesn't have green on? This is as close to a green shirt as I can find. So let's pinch them, right? Wake up. Okay? Yes. And then there was one up front. Yeah, go ahead. What's your name first? I'm sorry.
Gwen.
Gwen?
Yes.
Great, Gwen. Thanks for sharing. Go ahead.
I also have fibromyalgia.
Oh,
and
right.
arthritis.
Okay. So why are you here?
He wanted me to come.
He wanted you. Why did you want her here?
She doesn't have a thyroid.
Was that you? That was
I
you?
was thyroid. I don't have 2 parathyroid glands. I only have 2.
Yep. We're going to talk about that. Because there's something drastically important that you must do that technically all of us must do too. Like it's an absolute requirement if they've taken your thyroid off that you have to do this. But are we okay? Like before I start teaching, can I actually teach you guys something that I've learned? I'm a bookaholic. Anybody bookaholics? I read 2 books a week. I've been doing it for 10 years. I have probably polished off several thousand books. And I don't read like, romance novels and stuff like that. Harry Potter, no, I've read that, but no. I read books like this, How to Detox Your Soul by Craig Groeschel. You guys know who he is? How about Think and Grow Rich by Napoleon Hill?
Yes.
World famous book, right? Over 100 million copies. How about Mastering the Millionaire Success Habits? Okay? I've been to Tony Robbins conferences. I get a lot of coaching because I figure if somebody can feed into me and I can feed into you, then you guys just got a free Tony Robbins conference, right? You know how much this conference is? $8,500. It was amazing. I loved it. And I walked away with one thing. You cause your own problems. And I'm like, oh, I already knew that. Okay, but there's this thing, and I really encourage you to do it. It's called the 7-step, write this down, why exercise. Right? Gwen, if you're okay with it, I'll help. We'll do this with you. There was someone else that raised their hand. Was it you, ma'am? Did you raise your hand? Somebody over here raised their hand. You can. You're okay. She's like, forget her. Me. What's your name?
Shawanda.
Shawanda. Can I try? S-C-H-W-A-N-D-A? S-H-A-W-A-N-D-A. That's a beautiful name. Okay.
I have Hashimoto.
Okay.
Menopause.
Okay.
Arthritis.
Okay.
Sleep apnea.
Uh-huh.
Yeah, a lot more.
I have Hashimoto's also.
Oh, okay. That's the autoimmune thyroid, by the way, guys. Remember, I was like, who knows about autoimmune thyroid? Okay, you guys know you have it. Yeah.
I did.
Yes?
Yeah, other autoimmune rheumatoid arthritis.
Right, they go hand in hand. When you have one autoimmune disease, you often have 2 others, right? Actually, it should be 2 and then 3. Typically, when there's one, there's more, right? Okay? So, I think that's pretty good. So let me ask a question. So Gwen, why do you want those conditions to go away? The reason it's called 7 steps is you guys have to do this. You have to ask yourself why 7 times, because the answer, the real answer, is the 7th one. Okay, let's practice. Why do you want your issues to go away? Fibromyalgia, Hashimoto, all that stuff.
Yeah, I would like to feel better. I would like to get out of pain.
Okay, let's still feel better, right? Okay, are you guys okay if we do this real quick?
Yes.
So important. I want you to do it for yourself, though. So maybe write your answers down. You want to feel better. Ready? Why is it important that you feel better?
Because I can enjoy life.
Okay, ready? So she said enjoy life. You still have 5 more to go. Ready? Why is it important that you enjoy your life?
I can participate in more things with my grandkids.
There we go. So we got grandkids
Don't
now.
ask me, 'cause she takes
Right?
my chances.
Why is it important that you participate in things with your grandkids?
Because I love them and they love me to do it.
Yes, right? Love them. And why is it important that you love them?
Because they're my whole life.
There we go, right? So we're almost there. Got 2 more. Live. Why is it so important that you are life to them and they are life to you?
Because we feed on each other.
Okay, support, I'm hearing, right?
Yes.
And why is it so important that you feel supported?
Because kids need to be supported by adults.
So what I'm hearing is her passion in life. I hear that she likes to support children in her life. Maybe you were a teacher. I have no clue.
I
Okay?
was a hairdresser.
Hairdresser. Children's hairs?
Oh, sure.
So the reason this is really important is this, okay? Unless you know this one, you're not going to do what's necessary to make your fibromyalgia go away or Hashimoto's go away unless you can anchor to that. Does that make sense? So when I ask you today to spend a little money and get some testing done, I'm not doing it so that your fibromyalgia goes away. I'm doing it so that you can feel support and that you can now go out and actually make a difference in other children's lives, not just your kids and your grandkids. Anybody else? Right? Now, I could do all of you, but we'll be here for the next 7 hours, so just do, like, I promise you, it's life-changing, okay? Write down what you came here for today, and then when you leave here today, do the 7-step why exercise, something Tony Robbins teaches. This will tell you, A, your purpose in life. So you have a deep-seated purpose to do something with children, okay? And you feel it. That's why you love being around your kids and your grandkids. And what this is doing, your health is preventing you from doing that. So the reason why you should fix your health is not so you feel better, not so you enjoy life, not grandkids, but it's because of that. Are you guys with me on that? Like, this is massive if you understand this. And really, truly, you need to do it for yourself, okay? When I did this exercise, the why came down to the fact that I know God gave me this insane gift. I don't honestly know how it works. I can listen to someone and they'll say, Dr. Ernst, here's what's going on with my life, X, Y, Z, and it's like instantaneously I'm just like, I know exactly what's causing your problem. I don't know where it comes from unless it's a divine voice. And I go like this, hey, have you ever been tested for blank? And often what they say is, no, why would I get tested for that? I have thyroid issues. Why would I care about what my liver's doing? It's my thyroid, doc. I get that, but I'm hearing that you have something going on with your liver. Or I look at somebody's labs, and it's like my doctor says these labs are normal. Like MDs and even specialists who cost a lot of money, right? And then they forward their labs to me, and I'm like, it's right there. How did they miss this? That's a gift. You guys understand it? Like, I don't know where it comes from, but I know that I can do it. So that's why I'm here for you today instead of spending time with my family on St. Patrick's Day on a Saturday. Is that fair? And they know that this is my why, and they are fully behind me. My daughter even says, you got to wear green. I tried. Okay? My newest why is this guy. Now, he was born in 2016. His name's Gavin. We consider our kids to be angelic for 2 reasons. We do not have blonde hair. We do not have blue eyes. She does. So does he. He has blue eyes and blondish hair. And those of you who may have heard my stories and stuff like that, my wife and I had a really hard time actually having kids in the first place. I've been married 17 years. I got married when I was like 4. And for 10 years, imagine, trying, nothing, right? Maybe it's me, maybe it's her, nothing. And then we find out it was a toxicity issue that we both had. I had something preventing me from being able to impregnate. And my wife was so toxic that if a baby did get formed, it would have been basically killed off because of how toxic she was. So we fixed the toxic issues, and voila, 7 years ago, and now a year ago, and yeah, man, right? I think he's going to be like an Abercrombie model. Or, you know, Janie and Jack, right? Janie and Jack? That's what I'd like. Okay, so here's something else I want to teach, just because this is groundbreaking. Please write this down, please. It has nothing to do with thyroid, but actually has everything to do with it. Ready? Indecision. Okay, that means the inability to decide. Have you ever felt like that? I don't know what to do. Do I take my meds or do I not? If I don't, I'm going to die. If I do, I'm dying. I feel terrible, right? Right? Okay, indecision. That will do something called crystallize. We're talking about in the world of physics, quantum physics. This is Napoleon Hill teaching this in the 1920s. He says when you're indecisive, your brain does this. Well, then I'm going to start to build doubt. Correct? Like, I don't know. I don't think it's going to work. If I told you that if you literally went over there and did a handstand with your feet in the air for 5 minutes, and if you let me flick your nose, that you're going to have all your issues go away, I believe it would work. But do you? Because do you guys realize that what you think about comes into reality, right? So if you say, that's crazy, by doing that, it already tells me you have doubt. Anything is possible because God is an amazing healer inside of you, and it just takes action and faith, okay? When you have doubt, then it reinforces the indecision, which reinforces the doubt, and we get stuck. And when these two marry each other, you end up with the greatest issue in all humanity, which is fear. Got it? So if you have any fears about doing something different, it's only because you have doubt in your brain, which is only there because of indecisiveness. So watch. What is the best way to no longer have fear? See, somebody can help me with this. What's the best way to get rid of fear? Make, no, not take action. Make a decision. Make a decision. Decide that today is the last day that you feel the way you feel, you take your medications, or you don't know what's going on in your life. They have actually shown that when you have to make a decision, it's usually the road that everybody's traveling down or the one that most people aren't. I'm going to ask you a question real quick. I'm really looking at me. Is holistic alternative healthcare the road everybody's going down?
No.
Okay? It's the road that is less traveled. It's the weird one, right? Like, oh, you go to like a acupuncturist? That's weird. Why aren't you going to your doctor? Oh, you see a chiropractor? Whew, what's something weird about you? Right? Come on, let's be honest. Okay? I'm going to ask you to do something wildly strange, which is become your own doctor. Heal yourself. But in order to do it, you need to stop having doubt that it will happen, and you need to start making decisions. And what I've learned is the only way to know about making decisions is if you have to be options, right? You have to be offered an option, right? If I told you you could either do X, Y, or Z and you're going to heal, you must be able to pick X, Y, or Z. If you don't, you'll have doubt that it'll work, you'll be afraid you won't do it, and you'll still live your life the way it is right now. Fair?
Yes.
Yeah.
So it's all about Robert Frost. Now, obviously when we read it, we're like, ooh, I want to take the road less traveled, right? It's poetic, feels good, it's artsy, right? But then you start going down that road and you're like, this is weird. Like, I have to eat butter? I was told butter will kill you. Water fast? That sounds, I don't think I can do that. Doubt, right? So just be really careful. Your brain's going to talk to you a lot. And in fact, your decisions determine where you go. Would you agree? If I decide right now to stop putting deposits into my bank account, what's going to happen? Well, that's what's happening, but so I stop depositing, what's going to happen to my account? Well, it depends. It's only going to stay the same if I don't take anything out of it. Is that realistic? No. So if I stop depositing into my account, my balance is going to go down. So it was my decision as to why my balance is low. I don't have enough money. I don't have enough money. You made that choice. You decided. I know it's tough, and it's tough. But I'm talking about your health account. Are you depositing into your health? Because what you guys are doing is you're taking out all the time of your health. I ate that McDonald's. I knew I shouldn't have, but I did it anyway because it made me feel good. Because I want to feel good, right? Everyone wants to feel good. We want to feel supportive. We want to love our life. And we want to do things that make us feel this way. Yes or yes? Okay? But then we pay the price for it later on, right? So they've done studies on this. If I give you, which I'm going to today, the answer for your problem, and you might go, how can I give each of you the answer for each of your problems, okay? Because there's really only one cause of all disease. Are we okay if I say that? One cause, which means whatever's going on in your life, the cause is the same as whatever's going on in his. Whatever's going on in his life is the same as yours. Does that make sense? If you fix the one cause, then all disease goes away. And I'm curious if you guys know what the one cause of all disease is. Yes?
My decisions.
Yes, thank God. Thank God, right? Because your decisions determine your destiny. They've done studies on this, and they said this. Look, if I told Joan's been a patient of mine for, God, like how many years? Like several years now, right? If I told Joan, I was like, Joan, do this and you will get well. Okay, I know Joan, so I know she's going to do it, right? But if I come up to somebody who I don't know personally, and maybe she doesn't know me personally, and I'm looking at her and I'm going, do this and you will get well, did you know that there's only a 3% chance she's actually going to do it? They've studied it. You give 100 people the answer to their problems, and 97% of them don't do what they're supposed to do. Spend less than you make. Nope, we spend more than we make. Save 20% of your income. Only 3% of people do this. Tithe 10% to your church. You know this? Church statistics nationwide, they have a 3%, 10% tithe rate on average. Why? Because this is the doubt. Well, I don't know that it's going to work. I don't have the money to tithe 10%. It's an excuse. Does that make sense? So your excuses are what holds you back. What do you think the number one excuse is that's the pink elephant in the room that I need to crush right now? Open your packets, right? I know you guys have done this, especially those of you who are here like a half hour early, right? With the red folders, you're like, ooh, this is nice. Look at all this stuff. And then you pull this little half sheet out and you go, $897. This is ridiculous. Maybe. Or maybe you're like, ooh, what's included in that? Ooh, consultation, exam, etc. But how many of you went like this? I wonder if my insurance is going to pay for that. Let's be honest. Will my insurance cover this? Okay, thank you. Thank you for being honest, sir. Right? Or maybe you're like this. I don't have that kind of money for my health. I'll pay attention, but I ain't doing anything today. Right? It happens, doesn't it? I'm here to tell you that that is the retail cost for you to do one consultation with me according to your insurance, national average. Okay? I'm going to give some discounts today. I like to give stuff away. We're going to give $400 away to anybody that wants to have an evaluation with me. And I'm going to include 2 more individual visits. It's 3 separate visits, 2 hours of my personal time investigating into your health, $400 off. Can I just put it off the table for right now? Yes? Is it out of your brain? So you guys going, okay, he's going to talk about this later. Okay, I've done this long enough. I know, see, it's uncomfortable, isn't it? You guys are like, I just want to tear this sheet apart, right? Hang on to it. This could be your lifesaver, all right? You get to decide. It's your life. It's your health. Here we go. Everybody ready?
Ready.
Great. So, the only reason I'm doing this is because I have a radio show today, and I have to make sure I get out of here on time, and you guys probably want to get out of here before 6 o'clock. Yes?
Right.
When I said there's only one cause of all disease, you were right. It's the decisions we make. But if we break that apart now and we focus on the actual nature of our health, there are 3 main causes, and I want to call them sort of like, go to the little thing on your packets that looks like a stool. So you've got this, and then you have these 3 legs, okay? Here's what I teach, okay? Your health is based upon 3 things, and it's really, really specific that you understand the 3. Okay, I don't know, I don't remember if they said it or not. Obviously, I'm a Christian. I believe that God made our bodies. I believe that you are more powerful than you even give yourselves credit for. I believe there's magic in the biblical numbers. Someone tell me 3 is a sign of what?
The Trinity.
The Trinity, right? So it's Father, Son, and Spirit. So it's very unique that we have 3 main interferences, or 3 foundations, pillars, okay? If your gut is healthy, science has said that's 80% of your immune system. Yes? Okay, so can your immune system heal you?
Yes.
Yes. So if your immune systems work, you would be healthy. So your health is based upon the strength of your immune system, which is based upon your gut. So your gut is a very important thing to pay attention to. Now, everybody, I know you're writing, but look up at me. How would you right now fix your gut? Or change your digestive system? Heal what's going on in here. How would you guys fix that? Yes, ma'am.
Change my eating.
Yeah, so we wouldn't want to put as much crap in. We'd want to eat like broccoli and kale and apples. And, yeah, healthy stuff. We gotta watch out about paleo. Paleo is very dangerous. So I gotta talk about that with you apparently. Paleo is not the way to go. Okay? What you gotta pay attention to is that doesn't actually fix your gut. Your food has nothing to do with your health. I'll give you an example. Anybody know vegans that get cancer? How's that possible? Well, partly, yes, you're going down a good path. But don't they eat pretty good diet, right? Relatively? Fruits and vegetables, nuts and seeds, etc. But it's the toxins. So you kind of helps me, right? What's the next one you think then? Toxins. Because you could do everything right, but be highly full of organic or inorganic materials. And will that rob your health? Okay, yeah. If I drink a gallon of bleach right now, who do I see like in the next 30 seconds? Jesus. And he's going to say, idiot. Like, I believe that, right? We get to decide how long we stay on this earth. Like, totally curious question, off topic by far. How long are we supposed to be on this earth? 120 years. Boom, come on. Boom. But when I say 120, those 97%ers, they go like this. Man, I know a 90-year-old who looks like, I do not want to be 120. Because 120 is going to be like misery, lots of medications, hooked up to machines for your organs to work right. That is the wrong view. You're supposed to be vibrant, alive, healthy, and healing. The Bible even says you're supposed to just go out like a candle flame stops burning. Fully bright and vibrant. And most of us are not doing that, right? So your gut could be interfered with. You could have a ton of toxins, or the biggest and the hardest for everyone to even know is your nerves could be interfered with. And here's what I mean by that. Do you think your brain has the ability to tell your organs what to do? So if you have an interference in how your brain talks to an organ, could that cause a health issue? Do you have nerves that go to your thyroid? Your pancreas? Your heart? Your skin? Your eyes? Your hair? Your toenails? So can nerve interference create a health issue? Yes. Now, when I say the word nerve interference and I ask you, how would you know if you have nerve interference? What do you guys think the answer is? Doc, I would know if my nerves are interfered with because I would, what? Feel it? Okay, what's another sign of nerve interference? Like no transmission across a nerve. Pain. What else? Numbness. What else? Paralysis, right? Difficulty moving. So you might go, I have no pain, I have no numbness, everything moves, so I guess I don't have nerve involvement. That's not necessarily the case. You need to look to see if you do. Does that make sense to you guys? So it's really, really, really important that you understand 3. Now here's the other reason I teach the 3. When most people want to get healthy, their first action is, I'm going to, well, that's one, exercise. So let me ask you real quick, okay? Exercise. Exercise fixes which of those 3 legs? Does exercise fix your gut? Not like I got nice abs. I'm talking about the bacteria, the connections. Does exercise fix your gut?
No.
Okay, does exercise decrease your toxicity?
No.
It actually increases it. You know why? Because when you sweat out your water, and if you have toxins that are not water soluble, you hyper-concentrate your toxins, and you're now worse. Anybody ever exercise and feel like they're dying? It's because you're increasing toxicity by working out. So does exercise make you healthier? No. Oh my God. Then what have I been doing all these years? I'm here to tell you today, you do not have to exercise to get your health back. Like, praise Jesus, hallelujah, right?
Amen.
Okay? Does exercise fix your nerve system? No. Okay? Does eating right fix the gut? It might help it. It might decrease your toxicity, but most of us have been eating like Fruity Pebbles, Cocoa Puffs, and Dr. Pepper for breakfast. Like I was raised on that, right? That was my breakfast when I was a kid. And we might eat organic and go clean and everything else, but if you have a nerve involvement or you have high toxicity, you guys see what we have been told by the government, by the medical system, is not what health is. Health is you learning about the Trinity foundation that God said, no. If your gut is working, if you're non-toxic, and if your nerves are connected, I have pre-programmed you to have all of your health, have all of your life, have all of your abundance. Isn't that amazing? And that's what I teach people. Just let's check these things, let's fix these things, and it comes back. All I'm going to do today is replace the word health with thyroid. Because guess what? Your thyroid is based upon these 3. Now you might have diabetes, so I could do diabetes and do a diabetic seminar like I did not that long ago. You could have fibromyalgia. I can write fibromyalgia here. You could have Hashimoto's. I can write here. You could have, what was the M for again? Who is this? Menopause. You can have menopause. You can have arthritis. You can have all these issues. They're all based upon those 3, always. Does that make sense?
So there are 3 causes of thyroid, but actually they cause everything. And what we need to do is learn, how do you find out if you have them, right? How do you know if your gut's not working right? What do you think most people tell me? Hey, you know what? There might be a gut issue. Doc, I think you're wrong. Help me fill in the blank. I go to the bathroom with no problems. Oh, really? How often do you go? Once a day? That's not good. Really? How often should I go? How many times do you eat? I eat 6 meals a day. You should be going 6 times a day. You're going 1/6 of it. That's unhealthy. Well, I feel pretty good. I don't think I have any problems. You see how it works? Because we don't know, right? So I want to show you triggers that make your thyroid become worse. And then I'd like to teach you, if you guys will let me, how you fix these 3 and how everything goes away. High blood pressure, high cholesterol, diabetes, MS, Parkinson's, Alzheimer's, even the hard ones. Cancer. Gone. And I've seen it happen multiple times. Stage 4 cancer patients come into my clinic all the time. Those of you who, isn't it nice? Like we have like the 3 powerhouses. You guys have been patients for years, right? And Ron, right? Welcome. So guess what? I see people that come to me going, please help, please help, please help. And when I tell them I can help you and here's what you need to do, the number 1 question everybody spits out of me is what? How much does it cost? Ye of little faith and doubt. What if it was free? Would you do it? Yeah, but guess what? I used to do that. They don't do it. No value. If I gave you a Ferrari that was free, you would drive it like it was not yours. You agree? Oh well. But if you bought it, what would you do? You wouldn't even drive it. No, seriously. You would leave it in the garage. And you would like baby it and talk to it and sing to it and everything else, right? Because you paid for it. Make sense? We value what we pay for, don't we? So watch out for asking the question, how much does this cost? What you're telling me is, I don't know that I value myself enough. Secretly you are. Are you guys okay if I go deep? Can I go deep with you? Okay? 30 million Americans, according to the Association of Clinical Endocrinologists, have thyroid issues. 30 million. Almost 1/10 of our entire population in the United States. That means 1 out of every 10 people in the U.S. has a thyroid issue. The problem is only half of them have actually been diagnosed by their medical doctor, which means 50% of people walking around going, I'm tired, I'm constipated, I can't lose weight, don't think it's their thyroid because why? Their doctor says, your thyroid looks fine. The tests say you don't have a thyroid problem. But I'm going to teach you today they're not checking your thyroid properly. You might. 90% of women over the age of 40. That's a huge number, yes? 90%. If you're over the age of 40, you have a 9 out of 10 chance that you have a thyroid issue, but it has been undiagnosed. 9 out of 10 chance. And then, this doctor, who's an MD, who's a thyroid specialist, says it's also men and women. It's not just women. Number 1 endocrine disorder in the entire United States. More people have this hormone messed up than anything else. And you're going to learn today, this hormone makes you have the hot flashes, the menopausal issues, high blood pressure, high cholesterol, high triglycerides. It is the master hormone that sets all of your other hormones. So if you have low T, high cortisol, estrogen, progesterone imbalance, the cause of that is your thyroid not working, and the cause of that is one of these 3 or all 3 together. Am I going too fast? Are we okay? Deep breaths, deep breaths. 80% of thyroid conditions in women, they are more likely to be found in a woman, and I will tell you why today women have more thyroid issues than men. I'm curious if somebody watched one of the videos I did on Facebook and can tell me why. Why do women have a higher chance of having thyroid issues than men? Did you guys see the video? Did anybody see the video? No? You did? Help us out. Oh, don't put me under the bus.
They go to the doctor more.
Partly. That was my radio show. Okay? Because think about it. Between my wife and myself, if I think I have a health issue, I'm just going to say, I'll wait till it falls off. She goes, no, this isn't right. I'm going now. Would you agree? Women are really attuned to their body. But who has more estrogen, a woman or a man? In general, right? Some men have high estrogen, it's problems, a health issue. But by nature, women have higher estrogen. Watch this. Estrogen shuts off your thyroid. Physically. High estrogen levels will shut off your thyroid. Now, a lot of women are being told your estrogen is low, yes? You have low estrogen. You need to take estrogen. You need to be put on hormone replacement therapies. Did you know that there are 4 types of estrogen? So if this one is high, but the doctor checks this one and it's low, they'll give you more of this, and you'll just do this, and you'll shut the whole system off. Estrogen makes your thyroid not work. So why do women have a higher chance of having thyroid issues? Because you naturally have more estrogen than men. Make sense? And so those of you who are females should do what? Get your estrogens under control, and your thyroid will fix itself. But now that's like, wow, we could do a whole seminar on estrogen, right? This is a classic thyroid, right? Cold all the time. Anybody? Like all the time. Like it's 900 degrees outside, everybody's literally wearing Speedos, and you're like this going, it is freezing. You can't regulate your temperature when your thyroid's off. Hair starts falling out, right? Does that ever happen to anybody?
Oh, yeah.
Especially for a lot of women, they'll look down and like the drain in the shower will be clogged because of all the hair that's been coming out. When you do work out, because everybody says, you know what you need to do? You need to work out more. Go to the gym. Fight that disease off. Right? Push it back. And then you do it, and you're like, I'm so tired, this is ridiculous. Or you go, I don't even remember half what you just asked me to do. Now, this is the hard part with me doing thyroid events. You guys will go, wait, what? Well, how many legs? It's just inherent. Because when you're sharp in your brain, it's your thyroid making that happen. So I do realize I'm going to repeat myself multiple times. If you're here today and you're like, didn't you just say that 10 minutes ago? Then you probably don't have brain fog. The brain foggers are going to go, well, that's amazing. I've never heard that before. But you actually did, just it was 20 minutes ago. And then you go to your doctor, right? Because our doctors are supposed to heal us. So we go to our doctor and we say, I'm cold all the time, I'm tired, my hair is falling out. Can you tell me why? And don't they go like this? Hey, you might have a thyroid problem. Let's test your thyroid. Your TSH is normal. Your T4 is normal. It can't be your thyroid. It can't be your thyroid. And they're wrong. They're wrong because they don't understand the entire picture, okay? You don't necessarily have to draw this. It'll be all over. Here's a national standard thyroid test. Tell me if you guys have had this done, right? TSH, T4, that's about as far as they go. If you're lucky, they'll start looking into T3s and things like that. So if you are clueless to what these hormones mean, thyroid stimulating hormone, TSH, okay? And then, I think my mic just went out. And then, la 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 la, that's the enemy shutting us down. I may just go with that. T4 is the hormone your thyroid makes. Okay, so Tom will bring some batteries in a second. If you go to a specialist, an endocrinologist, somebody that you have to pay more money to go see, right? They usually make you pay the higher fee, your deductible will kick in, or they're not in your network, but they're really well known, and they charge a higher fee to go see them. Yeah? Yeah, anybody? Okay. So what we have is more tests that can be run. We can get reverse T3s, etc. It's probably just batteries. And then you could go to like a functional doctor and they could actually look at enzymes and antibodies and go, wait a second, there is something wrong. Yet if that's all you did, what would they say? You're fine. Now you go to the endocrinologist, special MD that charges you $400 and it's not on your copay plans. And he says, you're fine. There's nothing wrong with you. It looks good. And then you go to a holistic doctor or somebody and they go, no, look, you have an antibody problem, which is... Your body is attacking yourself, and that's why you feel the way you feel. Now, whose name is at the top? Whose lab is this? That's me. Holy smokes. 2016, I think it was, when I ran this. And I was having problems. I was tired all the time. I was fatigued, and I was like you guys. And here I am. Do you see it? It's crazy, isn't it? The specialist, nothing wrong with you. You're good. You're getting old. You have a high volume practice. I see 300 to 400 people a week, and they're like, no wonder, man, that's ridiculous. You're stressed out. That's what's causing your symptoms. No. Look. So I have a problem with my body attacking my thyroid. I have since fixed this because, of course, I want to figure out how to make it work for me. And then when I do it, guess what? Somebody else is like, hey, can you tell me what you did? I mean, it's just inherent, isn't it? Remember Colleen in the beginning? She said there are 3 P's to medicine. Do you guys remember what they were? Who wrote them down? Anybody? Pills, procedures, poverty, and she also said pain. So I went with the pain, right? So like most people don't walk around like this. Oh, my thyroid hurts. Oh, I have so much neck pain because my thyroid hurts. Would you agree? You can't feel your thyroid. That's why it's the #1 most misdiagnosed or underdiagnosed condition on this planet. Because we wait till we feel things to go after them, don't we? If my knee is throbbing, aching, and swelling up, then we go. But when your knee is perfect, you don't go get it checked to make sure it never swells up, do you? A 3%er would. Somebody who cares about themselves and knows health would go, I don't have health issues. I don't want to have them the rest of my life. And then we get the P for the pills, right? So levothyroxine, Synthroid. These are the top 2 prescriptives. Has anybody tried this or taken this in the past? Just out of curiosity. Didn't even know it existed, did you? How about this one? Anybody? Yes? Okay, so you've seen somebody that's a little more progressive, right? Because this is the common start for an MD. Would you agree? This is like you going to maybe a holistic doctor going, well, let's try something a little more glandular and natural, not synthetic. This is an actual supplement you can get. So it's like a supplemental form. But there's a problem with all of this. Does this fix the cause? No. So even the natural stuff doesn't fix it. You just cover it up. Thank God you're not taking the synthetics because they're dangerous. That's less synthetic, but it's still just masking your symptoms. Does that make sense? You would want to get off all of them by letting your body heal by itself. At least that's what you guys told me in the emails that were sent. Okay? Poverty only because of this. Did you know, according to Money Magazine, the #1 reason we run into financial issues in the United States is because of what? Medical bills. #1. So we know that medicine can drain our accounts, okay? I'm not here to talk all about that. I'm here to tell you, though, that if you didn't know that a low thyroid is a problem, it has been linked to all these other conditions, right? So I think I heard somebody say they were having like hot flashes and things like that maybe a little early. I have nerve pains. I'm anxious and depressed. Hypertension, high blood pressure, high cholesterol. They're actually finding that if you've been taking statin drugs for years and your cholesterol hasn't come back down, it's because your thyroid is messed up. And they will have to take statins for the rest of their lives until they go after their thyroid. But medically, to go after your thyroid, what do they give you? Thyroid medications. It's just more meds and more meds. Is that toxicity? Yes. Are medications toxic? Yes. Okay, if I took all, where'd they go? If I took all 30 of these, 90, if I took all 90 right now, I don't have time to take this doc every day. 90 days? That's a lot. 1 a day? No. I'll just take them all right now. What would happen? Yeah, I would see Jesus. Thank you. But let me ask you a question. What happens after the 90th day of taking them once per day? Yeah, but what's happening to my body? If all 90 right now, boom, off this planet, where do I go after 90 days? Am I still on the planet? Yeah. But what am I?
Toxic.
More toxic. I'm sicker. So the medications we take that try to make us better are actually making you worse. They are another interference and another cause that you must get rid of. What I teach is remove the interference. You're going, yeah. I want to stop the meds. I want to remove the interference. How do I do it? Stop taking them. You're the one swallowing them. But doc, if I stop, help me finish the sentence. If I stop, I'll die. If I stop, I'll feel worse. If I stop, I'll gain weight back. If I stop, that's all just doubt. It actually didn't happen. You'd be amazed. When you fix the underlying cause. If you leave the cause and you stop, what happens? Exactly what you just said. If you fix the cause, you will be able to stop, and you'll actually feel fabulous. You'll have your energy, you'll have your life, you'll feel good, etc. Make sense? So these are the common symptoms again, and I'm showing you this because I need you to connect the dots with something here. Brain fog, weight gain despite diet and exercise, sleep issues, hot flashes, cold hands and feet, depression. This is a big one, guys. If the outer 1/3 of your eyebrow is gone, you're like, where did you go? And you like pencil it in or you draw it. This is more for the women than the men. Some men pencil their eyebrows. But if the outer third has sayonara, thyroid. Guaranteed. Thyroid. All the time I see it. Outer 1/3 gone. Dry nails, aches and pains, arthritis, infertility, right? Infertility, constipation, low sex drive. It's a big one. A lot of us don't like to talk about it, but we're like, yeah, it's no fun anymore. Thyroid. Heart palpitations, anxiety, etc. Okay? Definitely, I'm going to try to go as nice as I can with this because it's a lot of science. But this is how your thyroid works. Ready? Your brain secretes a hormone called TRH. Who has had their TRH tested? Who even heard about TRH? You did? Wow. It's like a $900 test. TRH? TSH maybe, but TRH? Maybe you have. I don't know. Okay, good. TRH is the hormone your brain secretes to tell your pituitary to release TSH. Most people are familiar with this. But help me out real quick. Ready? If your TSH is low, do you think it could be because your brain is not secreting the hormone that makes your pituitary make the hormone? But they don't check for that. You know why? There's no drug to fix this. None. Zilch. You have to learn how to meditate, quiet your brain, relax in order for that to start working. Now, TSH is a hormone that we are very familiar with in medicine. It is secreted by your pituitary gland. And the pituitary gland sits like literally in the center of your skull, like right smack in between your nose and your ears on the inside. And it releases something called TSH, thyroid stimulation hormone. It goes in the blood, it lands on the thyroid. So TSH, see it right here? Goes to the thyroid. Your thyroid sits in your neck, just below your Adam's apple. So like right here. It's about a little butterfly-ish looking thing. This is my best ability to make it look like a butterfly. Thyroid. TSH lands on the thyroid goes like this. T4 and T3 come out. Mostly, it's T4. We're talking like 90% or more, 10% or less. So you do make some T3 from your thyroid, but all of it's right here. Here's the secret that your doctor will not tell you. That is an inactive, non-functioning hormone. It does nothing for you. It is a precursor. It must be converted into the active hormone, T3. Is everybody okay with this? The reason you take T4 is because you can swallow precursors with no problems. If you took T3, you have massive side effects if you become hyper T3 toxic. They could make you hyperthyroid by giving you too much T3. So what the doctors do is they go, we'll give you T4, and we'll see what your body does with it. Okay? But all they care about is, does the increase in T4 shut off the TSH? Because if these are balanced, they'll go, oh, your thyroid's working perfectly. Yet your thyroid is actually more about your liver, your gut, and the cells themselves. Am I okay so far? Okay, so here's the TSH going to the thyroid. The thyroid goes, boom, and spits out T4. T4 will go into your liver, and the majority of it is converted here into T3 in your liver. So do you see how sometimes I say, oh my God, your liver is what causes your thyroid problems? And you guys might go, that's weird, my doctor's never told me about that. But your tests are telling me, like plain as day, here it is, your liver has an issue. So what do? I teach you how to fix your liver, and then your thyroid does what? Ping. And you go, it was a miracle, and I can get off my drugs, okay? Your liver converts 60% of it into the active form T3. T3 makes you feel good, feel alive, gets you, hyperactive, you feel phenomenal, you burn fat, no brain fog. It's everything you want. You guys are like, I want my energy back, I want my hair to stop falling out, I want to feel good, right? That's T3, okay? There is an option, though, if your liver is toxic or stressed out, to make this thing called reverse T3. Please write this down if you've never been tested. Reverse T3. It is the toxic form of thyroid hormone. If your reverse T3 is high, here's what you feel like. Tired all the time, forgetful, brain foggy, hypothyroid symptoms, cold, fatigue, weight gain despite exercise, can't remember things, your hair falls out, your skin's brittle, breaking, your nails, you guys understand? So you could have normal T4, normal TSH, high reverse T3, and your doctor will say, well, it's not your thyroid. Technically, they're right. But they'll also tell you, we don't know what it is. We don't know why you feel the way you feel. Take an antidepressant. That'll make you feel better. Okay? So, and I'm not kidding on that. Now, if reverse T3 starts to climb, the question becomes, it looks almost exactly like its partner, but they're like the evil twin. You guys know the analogy, like you got the devil on this shoulder and you got the angel on this shoulder? That's the angel. T3 says, feel good, love life. This one says, no, you hate life. You don't like yourself, you don't like your friends, you're tired all the time. It's about how much of that do you have in balance. If you've never been tested for it, I highly recommend you get tested. And even if your RT3 is high, you got to go, well, how do I lower this down? Has anybody asked their doctor to check reverse T3 out of curiosity? Anybody? What did they tell you? I'm just curious.
They said it wasn't a valid test.
Exactly. And can I ask you why they say it's not a valid test? Do you know? Why would they say,
I mean, I
don't
think
get it
it's
tested?
Because there's no pill to correct it.
Boom. Did you hear? There is no pill that you can take to make reverse T3 go down. If I run a test and it says MD right here, and the test comes back positive, did you guys know I am legally and ethically bound to give you a solution to the test? I must tell you what to do if you're coming to me as an MD. You can't just leave and have them go, I don't know what you need to do. They are required to give you a recommendation. So if I'm an MD and I go, I don't know what to do with it, so what I'm going to do is I'm going to tell her this. That's not a test you need to get. It's my professional opinion that that test is useless. And it's a tragedy because they don't know anything about it either. Okay? Then you can have this issue where the conversion is moving the wrong direction. And so if you are taking synthetic T4, there it is, so you're swallowing your T4, but if your liver's toxic, you will encourage this conversion to the reverse T3. Does that make sense to you guys? So the number one cause of a hypothyroid is not the thyroid, it's your liver being congested and toxic. 3 stools again, gut, toxins, spine. Does that make sense? Okay? If we can go a little deeper, let's talk about things like this then, right? So there's the thyroid butterfly gland, etc. The cells of the thyroid. Okay, I'm like zooming in, okay? We're going all the way in. Inside a thyroid cell now, the thyroid cell's job is to take iodine out of your blood, pull it into the cell, let the DNA that you have make a protein called thyroid globulin. Here's the reason I need you to understand this. The number of iodines attached to the thyroid globulin tells you what thyroid hormone we're talking about. So if I say T4, I mean thyroid globulin with 4 iodines. Really, really important you understand this, okay? If I say T2, T3, it's thyroid globulin protein with 2 or 3 iodines attached. Everybody with me on that? So your thyroid secretes T4, and somehow you have to get one of the iodines to come off for it to become T3. And where does that happen? In your liver. Do you see how your liver could be the cause of your thyroid issues then? Does that make sense? Now, in addition, there is an enzyme that you see, it's not here, but it's called thyroid peroxidase. It's the enzyme that attaches the iodine to the thyroid globulin. So when you look at antibodies like autoimmune, Hashimoto's, etc., you're going, well, are you building an antibody response against this protein, or are you building an antibody response against the enzyme? What happens if I turn the enzyme off? I cannot make... Oh, I've lost all of you, right? Okay. Iodine comes from the blood into the thyroid cell. There's a protein called thyroid globulin. There's an enzyme that attaches iodine to the thyroid globulin. If I attach 4 iodines, it's now called T4. If the enzyme is destroyed, you cannot make T4. So could your low T4 be because of an enzyme issue? Do they test you for that? If you get an antibody thyroid panel, that's what we're testing you for. Are you destroying the enzyme? TPOAB. Remember Colleen, it was 1,000? She was attacking the enzyme, so she's going, well, of course I have low T4. My body can't make it because the enzyme is being attacked. Does that make sense? You could also attack the protein. What if I don't have anything to attach the iodine to, but I have really good enzymes? I'm trying to build a house, but there's no nails. I'm not going to do it. It's really, really important you understand how your body works. Okay? So if I take T4 and I don't feel any difference, it's because your problem is not the fact that you don't have enough T4. It's probably a conversion issue. Most of the time, it's not actually your thyroid that's the issue. In Hashimoto's autoimmune thyroid, I can guarantee you your thyroid is not the issue. What's the issue is the autoimmunity that's attacking the thyroid. The thyroid is trying to do its job, but you're going, nope, 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 nope. So you need to top and bring the antibodies down. Does that make sense to you guys? If I bring the antibodies down, I can fix it. Okay? Before the 1970s, we didn't used to medically run blood tests for people for thyroid. We would go like this. Oh man, if you're cold all the time, if your hair's falling out, that sounds like thyroid. We would start to treat people based upon that. Did you know that? Off symptoms. Now, the gold standard test is something called TSH-T4. So if they come in normal, but you have those symptoms, they'll say, oh, no, you don't have thyroid. Does that make sense? It's weird, isn't it? So we used to base it off of how you felt. Now most doctors don't care how you feel anymore. They only care about their labs. Does that make sense? You could be like, Doc, my labs look great. I do not. What's wrong with me? And they'll go, I don't know. Because they don't care how you feel. They only care if the labs look good. So what we do then is this. We recognize that, look, did you know that there have been no studies published that show anything about how TSH connects to your thyroid function? Never a single medical study. So why do they use it? Because they talk to each other. If your T4 is low, your TSH does what? It goes up. Now watch. If I give you T4, what will TSH do? So they'll go, oh, we can make the labs look better. That's all we care about. Weird, isn't it? All they care about is making the labs look better. They don't care if you feel better, if you look better, if you have more energy. They just care about the labs looking better. I can give a drug. I can get a result. That's all I care about. They have no way of knowing, though, that there's actually no major reference values for TSH either. A medical test will say you could be as high as 5.5. If you're over 2, that's hypothyroid, functionally. So you could also be at 2.7 and have them go, you're good, but actually you're not. Because like the body is supposed to balance itself out. Your TSH should be between 0.5 and no greater than 2.0. I'm saying this to anybody that's ever had theirs already tested. 0.5 to 2.0 is the ideal. If you're at 2.6, they will say you are normal. If you're at 4.4, normal. But for me, highly abnormal. Something's going on, and I would want to go after it. Most of the time, also, when we talk about hormones, it's not the actual hormone that's the problem. Okay? Are you guys okay with me telling you that all of your cells in your body have receptors and that a hormone must land on the receptor for it to work? Does that make sense? Okay? What would happen, just out of curiosity, if something else was inside that receptor and the T3's going, dude, get out of my way? And the guy that's in there is like, no, I'm stuck. I can't get out. A heavy metal, a toxin, a virus, another hormone, like reverse T3, that looks a lot like T3. So if reverse T3 lands here, your cells go, oh, I'm so tired, I'm fatigued, I'm cranky, I don't want to do anything. And it doesn't let go. Reverse T3 does not let go. So what's the only way that your body can clear itself out? It has to destroy the cell, kill the cell, let a new one come back, and that's why you feel like you're dying, because your cells are actually dying. So could you have perfect levels and have an issue because your hormones are off because of having toxins around the cells? Yes. Does that make sense? Okay? So the glands and the things that are involved with your thyroid are your brain. So we want to make sure our brain is working, hopefully, correct? Our liver. So we got to make sure our liver's working correctly, and our gut. Now, real quick, how would I know if your brain's working properly? It's a tough one, isn't it? You're going to tell me it's not. I don't even remember what you just said. So I already know it's not. Okay, I'm going to show you how you test your brain for function. How do we test the liver? Can somebody help me? How do I find out if your liver's working properly? How do you think? What do you think? Liver panel? But that's a medical test, isn't it? So they would give you drugs, etc. There are tests. Do you guys realize this? There are tests that will show you if your organs are working properly if you know how to read them. I can look at your medical panels, and they will have said it's perfect, and I'll go, oh, there it is. I don't know how I do it. It's just like it pops out. It's like a red monkey just jumps out at me. It's like, ah, there it is. It's a gifting that I've been given. Okay? So in summary, real quick, if I can try to ground us, right? An autoimmune condition is when you have antibodies attacking your thyroid, either enzymes or proteins. Everybody with me on that? The real question is, where does the antibodies come from? I will answer that today, I promise you, okay? We also said then that if you have a hormone receptor issue because of toxicity or heavy metals, you could have perfect numbers but still have a problem, correct? So the way you fix that is get the junk out of the cell receptors. That would involve detoxing. Everybody cool with that I say that? Not weight loss detox, cellular regeneration detox. I got to get that cell to grow back again. That's a lot harder than a juice cleanse on aisle 7 at Whole Foods. You guys get that? Like that's not going to do it, okay? That Roto-Rooter colon cleanse, Renew Life 7-day detox, no. That's to get your bowels moving and to get you to lose weight. We're talking about regenerating cellular tissue, okay? If you can't convert T4 to T3, where? In your liver, you could have a thyroid problem. And if you have this reverse T3 dominance, then you could also have a thyroid problem, but yet it could look normal. Is everybody okay with this? So the real question is, what do you have? And the only way to know is to do what? Test properly. Properly. Be careful going, thanks, doc, I'm going to go to my MD. They pay for it. I don't have to pay anything. The 897, I'll just ask my MD to run it. Oh, watch out. They're not running the test that I'm running. Does that make sense? Be careful, okay? Once it comes out, the T4 goes around into your liver, and now here's what's wild. There is an enzyme that takes off the iodine. Do you guys remember I said in the thyroid there's an enzyme that puts it on? So in your liver there's an enzyme that takes it off. That's how 4 becomes 3. Now just recently, this is going to blow your mind, they're like, oh God, we found a new thyroid hormone. It's not new, it's always been there. T2, right? Because it starts off thyroglobulin with nothing, T1, T2, T3, T4. Guess what? You do have T1 hormones. They're just so minuscule, we don't see them, so we say they don't exist. Okay? We're now learning something about T2 that's wildly important. This enzyme sits inside your liver and your intestines and does all the work for you. And here's the funny thing about it. Enzymes need food. Do you guys know that? They cannot work without basic essential minerals. So what is the #1 mineral deficiency that could cause you to have a thyroid problem? Whatever that mineral is. Would you agree? Does anybody know what the mineral is that causes thyroid deficiency? Not iron. Not vitamin D. That's a vitamin. Mineral. Mineral. Zinc? Nope. Iodine. That's what everyone says. It's not. Iodine is what you attach to the thyroid. What enzyme turns what mineral turns the enzyme on to pull the iodine off? It requires magnesium present, but it's not the key. It's not calcium. Let's keep guessing. Nope. Potassium. See, they don't teach this, do they? You guys are like, what is it? What is it? But when I tell it to you, you're going to go, oh, that's right. Selenium. Selenium is also an anti-cancer the anti-cancer nutrient. Why? It stimulates your immune system. Selenium is required to land here to make that thing do its job. So without selenium, this enzyme that we know exists cannot perform its function. So could you have low T3, but have normal T4, normal TSH, and be told you have nothing wrong with your thyroid? Yes. And where does all the extra T4 go? It gets turned into reverse T3. Does that make sense to you guys? And it's the same enzyme that does it, except when you don't have selenium, it goes, all right, fine. All right, fine. Fine. Where's the selenium? I don't know. Make the nasty stuff. Oh, selenium. Oh, you ate some Brazil nuts. Oh. Does that make sense? When you have lots of selenium, it does the right thing. This guy goes down, that goes up. You feel like $1 million, and your doctor goes, I don't understand what you did. Selenium. That's weird. Am I losing you guys? Are we okay? Now, here's the problem. Half of you are going to run out here and go buy selenium right now, aren't you? Okay. Doesn't always fix the problem, though, does it? So let me see if I can ask you why. That would mean you don't have a vitamin deficiency. You may have a gut issue, you may have a toxic issue, or you may have a nerve problem. If taking something that's supposed to fix it doesn't fix it, it's because one of the 3 legs or all are involved. That's why it's so important to pay attention to gut, toxins, spine. Does that make sense to you guys? That's why if I eat well and I don't lose weight, something's not working properly. Well, I'm doing the stick diet. I'm eating tree roots and dirt and bark, right? I'm going paleo. I'm doing all this great stuff, and it doesn't work because it's not diet or health, okay? So here's this new one, right? T2. Look what the science says. T2 has the ability, this is T2, by the way. It's a fancy word, isn't it? T2 makes your liver take up oxygen better. Is that a good idea or a bad idea to have more oxygen in your tissues? Very good. Very good idea. Most of us are under-oxygenated, and that's why we can't stay awake. That's why we're always like, it's not a yawn, guys. It's a cry for oxygen. Did you know that? Yes. It's a cry for oxygen. If you're like, it's because you don't have enough oxygen. You breathe oxygen, you're going to be like this. Woo! I feel like $1,000,000 because it keeps you awake. It makes energy. Do you think it's important to have oxygen in your liver? Yes. What hormone does it? T2. Not 3, 2. Look at the research here. T2 has the ability to mimic your thyroid. Fancy medical term. Mimic your thyroid. It could look like T3. So if you have the right amount, selenium gets on the T4, turns to T3, sometimes to T2, and your body's like, oh man, I love you. I'm going to give you everything you ask for and then some. And that's what you guys are looking for, right? I want to feel good. I want to have lots of energy. There was even a study done, and this is like big guys, right? Journal of Hepatology. The journal of your liver is what it stands for. Make sense? Medical doctors studying this, and they went, hey, look, when we give T2 to cells of rats, their mitochondria increase their function, and they pull all the fat out of their liver. Is fatty liver a big deal today? Big deal. So if you want fat to come out of your liver, you need more T2. And if you want your mitochondria to work, which make energy, why are we so tired all the time? We can't make energy. You need more T2. Where does T2 come from? The conversion of T3 into T2, which happens where? In your liver. So your body will do it for you if you are healthy. Does that make sense? So all you have to do is get your health back. I love this one, man. Biological effects. They're saying what happens when you have T2 in your body. Ready? Watch this. T2 has the ability to stimulate cellular and mitochondrial breathing, and it mimics that of T3. The only place to get that T2 is in your own body by cleaning your liver out and addressing the cause. Do they test for T2? I've never seen anyone do it, right? So your body has more inside of you than there are on lab tests. Is it safe if I say that? Like, if it was 50 years from now, we're going to go, we didn't know anything, man. Look at all this stuff we now know. Would you agree? I guarantee you there's stuff going on inside of you right now that you would thank God that is happening that we don't even know is happening yet. Okay? Now, if you have an antibody issue, like, say, Hashimoto's thyroiditis, that means you are attacking this guy, the globulin, or you're attacking this, the enzyme. Okay? If you want to fix it, all you have to do is stop attacking the enzyme. So that's it. You guys can go home. Just stop attacking the enzyme. That's all you have to do. It's hard. It's hard, isn't it? It takes a lot of work. But I can show you real simply that if you address these three things and you have an autoimmune condition, it'll go away. This is where it gets wild. I can show you how if you fix these three things and you have a conversion issue, it will go away. If you have a brain hormone issue, it'll go away. If you have fibromyalgia, fibromyalgia will go away. If you have hot flashes, they will go away. If you have whatever you have, it will go away. And I know that's an audacious statement to have, yes? All you got to do is fix these three, and you will heal naturally. But isn't your body designed to heal by itself?
Yes.
It is? So then the question is, why isn't it? Because we are interfering. What are the biggest interferences that cause our body not to heal? Having a gut issue, being toxic, chemically stressed, and having nerves that are not working. Do you guys see where I'm going with this? Hopefully your brain is going like, oh my God, I got it now. And all you have to do is test these, because if they're there, and I show you how you can fix them, you will get well. And what have you just become?
Your own doctor.
Your own doctor. Fantastic. Got it? Okay. We're going to start with, ooh, I already did that, I think. We'll come back to that if we need to. We're going to start with the number one most overlooked, unchecked, undiagnosed cause in your body, which is your power. Help me out with this. Who's good with, like, you know, electricity or anything like that? Or could tell me, like, what's the problem here? Someone help me diagnose this. What are we looking at? Fuse panel, yes, right? Where's the problem?
15.
Number 15. Well, wait a second. These are 15 too, so be careful, right? 8, I know it's small. These two are definitely out, right? And it looks like something happened because, like, probably caught on fire or something like that, right? Now, help me with this, okay? If that was your dishwasher, will it work?
No.
Okay, is there anything wrong with it?
No.
Is there anything wrong with your dishwasher?
Oh, the dishwasher. Oh, the dishwasher.
It's fine. It's fine, right? So you go, well, it's not working. So something's wrong with it because it's not working. So you bring in the dishwasher specialist. He just happens to have a MD attached to his name. See the analogy? Okay? So the medical doctor comes in and he tests your dishwasher. But all the tests come back normal.
Right.
And he goes, I don't know. I don't know what's wrong. And you go, okay, I'm going to get a specialist. Now this guy has like FACP, DNCP. You guys know they have longer initials, right? He comes in and he goes, yeah, they don't know what they're talking about. I'm going to run some special tests. And we're going to do some special therapies to get this thing to work. And he goes, there's no electricity flowing through this. I'm going to hook a battery up to it. Okay, I'm going to put a battery behind it, and it's going to make it work. And guess what? It does. And it turns on. But then when the battery runs out, what happens? And then you go back to him, and he goes, oh, I forgot to tell you. You need to go every month to this place that has several initials, Walmart, Walgreens, Rite Aid, CVS, etc. And you need to get a battery every month and replace that battery. And you're going to have to do that for the rest of your life. Did I tell you that? I forgot. I'm so sorry. Here. Okay? And then you go. You see the analogy, guys? Okay? Or you could go, wait a second. I know how things work. Let's go look somewhere else. And you would go, oh, visibly, there's the problem. I found it. And I'm going to fix it. And you're going to be good to go. And that dishwasher is going to work for whatever its lifespan is. These days, dishwashers are horrible. I've already replaced 3 in my house. It's ridiculous, isn't it? They break all the time. What is this? Spine. It's the same as this, though, isn't it? Nerves, wires, electricity. So if we were to see that, is there an alignment issue? Help me. Can you guys see this? Like, you're not even trained in reading x-rays yet. Can you see it? Where's the problem? Help me out. That one? That one? They're out of alignment. So to fix this person's health issues, what do we need to do? Now, right now, some of you are like, oh, this is that kooky, crazy chiropractic talk. No, 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 no. Basic human anatomy. If the nerve is irritated, which nerve is pinched? The one coming out this way or the one coming out this way? This one, over here. This one, that's their left, that's their right. And over here, which one's pinched? This one. Causing this. That's weird, isn't it? You're not supposed to have this massive blob in your intestines. And is the heart a little weird? Yes or yes? Yes. Is your heart supposed to be on the right side of your body? No. Why is the heart on the right? Nerve damage. An enlarged heart. Every doctor under the planet. I don't know what's causing this. Don't know what's causing it. Remember I told you I have this ability to just look at something and go, there it is. Now you guys can do it too, though, can't you? The only thing is I bet you didn't know this section of your spine controls your heart, and I doubt you knew that that section of your spine controls your intestines. So it makes sense to me because I know this. Okay? Do you have nerves that control your organs? Yes or yes? Yes. Okay? Where is your thyroid nerve? 3, 4, 5, 6. Thyroid. That's your neck now. Okay? So if you zoom into the neck, you're going, okay, skull, which holds our brain. Okay? This is a brain test, guys. And if the brain can go through the skull into your neck, the first bone protects it. Then you have second, third. Which ones were thyroid again? 3, 4, 5, 6. So second, third, fourth, fifth, sixth. Okay? See how there's a space between the bones that lets the nerve come out. This is really good, by the way. This is like near perfect. Okay? You want your brain to be centered over your shoulders, not over your head, not over your knees or something like this, right? This is really bad. Would you agree? Okay? You want this and this. And you want this space to be wide open to allow the brain to flow through and go in. Do you think we could take an x-ray and find out if your brain is communicating to your organs? I'm just curious. Do you guys think we can do it? Yes. But will a medical doctor do that? No. No? So I do a scan. It's a neurological scan. It's a very special machine. We roll up your spine. And it shows us where the nerves are inflamed. So again, where was thyroid? 3, 4, 5, 6. This is a lot. This is a lot going on, by the way. This is sinuses. This is upper respiratory, heart function, and then the adrenal glands. And then everything else is okay. So I can just do a scan and go, I know what your problem is. Isn't that fun? I love doing what I do. Because I can go, you've been searching for an answer for however long. I found it. But then what happens? Don't you go back to the... Really? Doubt. I'm a little nervous now. I'm kind of afraid. What are we afraid of? Number one fear, when I show you the cause of your problems. Well, yes, but cost. How much is that going to cost me to fix? Why do you guys ask that? I'm just curious. Because we're afraid. It's basic fear. We're afraid that we can't afford it, right? It's fear. I'm afraid I can't do what I need to do, doc, and I'm afraid I'm going to end this life early. I'm going to off this planet. Okay? Is this neck normal? No or no? What's the problem? Straight as a board, and there's no space between here. The ear is supposed to be over the shoulder, which it is. What's happening? Is that open or closed? That is thyroid nerve damage. Plain as day, visible in X-ray. How many of you have had an X-ray to find out if you have organic health issues? Only these four, and Fred, and yes, right? Because there he is. Okay, the rest of you that have read folders, I've never done that to you. I would love to. That's why I came here, but I cannot make you. Make sense? You have to decide. Okay? Getting better? Yes or no?
Yes.
Same person. 2 months. Same person. Better?
Yeah.
Yeah. That was Angela, my clinical assistant. And she didn't get to share her full story, but 50 pounds down, no longer taking any medications, not having any health issues. And she used to work for a chiropractor before coming to me. A chiropractor, right? Crack, crack, off you go. I don't do chiropractic, guys. I do spinal rehabilitation. I reset your spine to the position it's supposed to be in, and your body will heal by itself. And actually, we're so good at it now that we can often see changes after just one visit. One visit. We X-ray, we adjust, we X-ray, we show it to you, and I go, hey, that was 40% improvement. You want to keep going with it? And who gets to decide? You do. It's your decision. Always your decision. Is the scan better? Yeah, it was this before. Now, you might look at this and go, I don't know what I'm looking at. Like, it doesn't make any sense to me. That is nerve damage visible on a nerve scan, and then that is X-ray improvement of it, and that is proof that it got gone. And she's the living proof because her health came back. Right? Is that what your doctor does? Did they do that for you? So we need to test. You got to stop guessing with their health. I would never want to guess with my health. Would you agree? Like, it's the most valuable thing you ever have. I don't care what you say about you can't afford stuff. When you lose your health, all of a sudden you figure stuff out, don't you? I've had people sell houses and cars and purses and jewelry that they said they didn't have money for their health before until they start selling their stuff, right? But that's when it's crashed and gone, right? There are tests you can do to look even further. I know this is fuzzy, but would you agree that that's kind of sloping off to the right quite a bit? And would you agree that there's like a major difference in these two spaces? That is your first cervical bone and your second bone. Guys, this person has had chronic health issues for 45 years. Went to everywhere you could imagine, Mayo, Duke, Johns Hopkins, you name it. Came to my office and I was like, there it is, I found it, I'm going to fix it. And he's like, I don't understand, you're just a chiropractor. Like, this is ridiculous. I've been to many, many, many chiropractors before. And I said, I'm not a chiropractor. I have a chiropractic degree because to move a spine, you have to. Does that make sense? You can't adjust someone unless you have a chiropractic degree. But I also have a functional medicine degree, a physical therapy certification, holistic. Like, I never stopped going to school, guys. And the reason is it's simple. If your brain can talk to your body and your body talks to your brain, you're healthy. It's that easy. It's the number one misdiagnosed thing because you guys go like this. My neck is good. It does not hurt. My thyroid must be working then. Test. Test. Don't guess. Let's listen to what Sarah has to say.
Hi, my name's Sarah. I'm excited to share a little of my story with you today because about 6 months ago, I was you. I had heard about a seminar my husband found on the internet about thyroid issues and are you struggling and haven't received any help? And that was me. I was diagnosed with thyroid issues about 20 years ago and I started Synthroid and it was fairly manageable most of my life, but about 3 years ago I hit a wall. I was exhausted all the time. I couldn't get through the day without sleeping. I couldn't think clearly, couldn't communicate, which is very uncharacteristic of me. I was struggling also with some severe anxiety and depression, also very uncharacteristic of me. And I was starting to feel fairly hopeless. I remember going to Walmart one time, and after I did my grocery shopping, I had to sleep for 20 minutes in the car before I was awake enough to drive home. I went to the doctor and said, what is the deal? I can't function. And they upped my medication, and they gave me an antidepressant. And nothing was helping. So when I heard about the seminar and I came and heard what Dr. Ernst had to say, honestly, I thought, this can't be right. It's too simple. And yet this idea that our body is very complex and there are a lot of systems that have to work together made a lot of sense. He did the most thorough assessment of my health that I've ever received. And after seeing my deficiencies and toxicity levels and things that were out of line and that needed adjustment, I started on a treatment plan. And within 3 weeks of adjustments, I started to wake up. And within a month or two of being on the nutrition plan, I began to feel like myself again. And I can't tell you how exciting that was. I'm now through the initial treatment plan, and I'm awake and I feel wonderful. I have a lot of energy. I lost 20 pounds, which was a lovely perk. The whole thing has been challenging, but totally worth it. So I'm here today to say, listen well. And if I can give you any encouragement, it's to trust this process and know that it can give you your life back. So
That's powerful, isn't it? She also didn't say anything about her numbers. So I have some tests that I run on people quite often. So she said she lost 20 pounds, so we tracked it and monitored it. She completely cleaned her gut out. I'm going to show you guys this test in a second. This test tells me how leaky your gut is, if you have a gut issue. Her thyroid antibodies, reverse T3, see the toxic one I was telling you guys about? Toxic, is it high? Yes. Her T4 direct in her bloodstream, too high. Antibodies. Remember I said you can kill the enzyme or you can kill the protein? What is she doing? Oh, both. Major issues when I first met her. That's now. Off all of her meds in less than 6 months. She took the road less traveled. And I'm going to give you guys an opportunity soon to do that if you want to. Does that make sense? So the challenge becomes, if we have neurological imbalance, you have to check for it and you have to have somebody help you correct it. And I know some of you are right now going like this, right? Well, how long does that take? How much does it cost? Does my insurance pay for that? Right? I mean, it's just natural, isn't it? But the ultimate question is, I don't know how long it's going to take until what? I take a look at it. If your neck has lost 20% of its curve and there's 30% compression to the nerve, it will take less than if you've lost 100% of the curve with an 80% compression. I mean, does that make sense? So if you really want the answer, test. Okay, how much will it cost? I honestly, right now, I have no idea. I do know that if you ask me to bill your insurance, it's going to cost a fortune. A fortune. Not yesterday, it was this week, I had a husband-wife couple come in. They had a UHC, you guys know them, United Healthcare, and they both came to one of my seminars. They're like, we love what you do. We want this to work. We have really good insurance. We should have at least 80% coverage. And I said, yeah, guys, if I was a medical doctor, it would be covered 80%. And he goes, I don't understand. You are a doctor. I'm like, I'm a chiropractor, functional practitioner. I don't carry an MD. Your insurance says we pay 80% of MD therapies. And he looks at me and he's like, well, how much does it cost? Okay, if you ask me to bill your insurance, for you and your wife, it's $27,000 for what I'm going to offer you. And he looked at me and he goes, how much do they cover? 0. Now, I can give you a better price. I can cut the cost down and make it much more affordable, but I cannot do what? I cannot bill your insurance. And I just said, you have option A. You see, guys, what is it about? Making a decision. You have option A, or this one is 70% less expensive. Which one do you want? What do you think he said? I've never met anybody that's like, I'll pass on the 70% discount. Have you?
Nope. No.
He picked this one. Okay, you guys have to decide. I don't know what the costs are until I take a look. If there's a gut involvement, everybody said leaky gut, right? So our gut's involved. What a leaky gut does is it causes us to not absorb our nutrients. And if you don't absorb your selenium, thank you. If you don't absorb your selenium, could you have a thyroid problem? Yes. Magnesium is required for that. B12 is necessary for your energy. And then when that goes on a long time, your immune system will get freaked out. And then it starts to make you have other issues, and then you build autoimmunity. Listen, I need to talk to whoever has been diagnosed autoimmune. The cause of your autoimmunity is your gut. Does that make sense? Your gut causes autoimmunity. I have rheumatoid arthritis. It's your gut. I have lupus. It's your gut. I have Hashimoto's thyroiditis. It's your gut. Does that make sense? How does this happen? Well, the cells of your intestines are supposed to be really tightly knit together to stop stool, viruses, bacteria, toxins, and food particles from getting into your blood. Would you agree? We want all of that to go where? Out, right? To the toilet, okay? Now, what a leaky gut is when the cells of your intestines have split apart and they allow stuff to leak directly into your blood. Okay, what would cause your cells to spread apart? What would cause your intestines to have holes punched into them? Huh? Gluten is one. It's the main thing. It's the foods that we eat. Would you agree? So when I go to Bojangles, because it's only $2.99 for 7 crispy chicken wings and I get a free 27-ounce Coke, it sounds good because it's cheap, but it's literally going and it's punching holes in it. Now here's what's wild. Your body knows there's holes there, yes? Of course it does. So what does it do to try to fill in the holes? What do you think it does? Well, it's going to inflame so that we can inflame the cell to try to make them attach. But inflammation over long periods of time causes scar tissue, adhesions, etc. Or it goes, well, I need to put something here. What is nice and sticky and soft and easy to put in between two cells? Cholesterol, which is also a type of fat. So it'll put this here. Do you guys see why thyroid could maybe cause your cholesterol to go up? Ooh. Isn't that wild? Now, if you have lots of fat deposits in your intestines, we could run a test to see how much fat is just right here, couldn't we? If you write this down, if you have more than 50% of fat in your intestines, your gut is leaking. Guaranteed. So how do I find out how much fat I have here? We have to test, okay? So I'll come back to that. Remember I said I have a test that can check for leaky gut? This was a woman that came to one of my events. She weighs 210 pounds. She has 91 pounds of fat. You know what's funny? She goes, God, I only lose like 10 pounds. 91 pounds of fat on her. Is that a lot? Okay. Of 91, 45.4 is in her trunk, which is her intestine. Is that more than half? Yes. Okay, so she's right at it. So that tells me she's pretty much leaky gut, right? So we could start working on this, start changing things, and look what happens. Boom, 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 boom. Weight down, body, body, body fat down, water up, because she was chronically dehydrated as well. Better, better, better. 4 months, okay? So my hairstylist, who I go to cut my hair, right? She's always complaining to me. I'm tired all the time, I'm fatigued. I'm like, you know, it could be your thyroid. Tired all the time, I'm fatigued. My thyroid tests are normal, doc. Come into my office. Took her a year. I'm seeing her. She cut my hair now for 10 years. It took her literally years to come in. And it's like, boom. I mean, come on, right? That's huge, isn't it? Total 64 pounds. Never went to the gym, off all her meds. I don't know about you, but that's not traditional. Would you agree? Okay? And I could stay here for the next 45 minutes and show you after and after and after. That is my office manager's mom. She lives in Asheville, North Carolina. 2-hour drive one way, 2-hour drive back. Are you worth it? Is 2 hours too far for you? I had this one lady at my event once. She might be watching. Stood up in the middle of our event and goes, this sounds really cool. Do you have an office in Charlotte? And I was like, ma'am, we are in Charlotte. She goes, this is Charlotte? I live in Ballantyne. This felt like forever to get up here. You know what she told me? I don't want to do it. It's too far of a drive for me to come up here to Charlotte. Okay? It's another patient. And look, I can keep going, right? So I have videos. They're all over our website. We have over 400 reviews. I like this one because it was not that long ago, and she goes, I was working with Dr. Ernst. I had thyroid cancer. They threw all meds at me. I went into menopause early. I was gaining weight like crazy. Passionate doctor, very knowledgeable, blah, 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 blah. Oh, I lost 40 pounds. I feel great. I highly recommend it, right? I went to a thyroid seminar. After attending, I realized I should probably do this. Dr. Ernst also discovered that I was diabetic. My diabetes went from A1C 7.1, is that high? You guys know about diabetes? To what? Normal. In 90 days. I'm taking less medications for my diabetes, my blood pressure. Oh, by the way, I lost 35 pounds. I'm no longer tired. I've got lots of energy. My husband also decided to become a patient. It's incredible. We can't say enough. Blah, blah, blah. It's for you guys to read. It's for you to decide. I would love to see your name and your name and your name right there going boom. because we need more people finding out about this. Your gut is connected to everything in your body. If you have a gut issue, you're guaranteed to have a thyroid problem. And your adrenals are probably fried, which is tired all the time, and your joints hurt. Anybody have this? You wake up in the morning and you're like, I'm stiff, but by like the afternoon, you're like, oh, I feel pretty good. Thyroid. Because of a gut issue. Does that make sense? My sinuses are always clogged and running. I was told it's just allergy season. Thyroid. And gut. I can't remember, and I'm always anxious. I'm stressed. I'm depressed. Gut. Ready for this? Watch. Acne on the chin and the sides of your nose. Here and here. Thyroid. Thyroid. All thyroid. So, are we okay? We talked about nerves. Yes? You guys remember that? Brain connects to organs. Can you have nerve interference?
Yes.
How would you know? You have to get a special x-ray, right? Okay, our patients are answering lots. Let's let everybody else, right? They need to learn. They need to learn. They need to learn, right? Okay? Can you have a gut that's leaking and have that cause your health issues?
Yeah.
How do you know if you have a leaky gut? And what would be the test we look for? How much? More than 50%. How do we do that? You stand on a very special scale, you hold it, and it goes, and it prints off a picture of how much fat you have on all over your body. It's a massively impressive test. The last is the toxins, okay? Can you be chemically toxic and cause problems? Yes. These are the top 5 interferers with your thyroid as far as toxins. If you guys want to write them down, you can. If we'll go through each of them. We already talked about medications, though, didn't we? They are toxic, aren't they? Okay, so the Synthroid you're taking to try to fix your thyroid is causing more problems. You need to do what? Stop. Okay? How do you do that? Fix the, well, yes, right? But how do we do it and stay healthy and well as a result of stopping? Fix the cause, and then you will easily be able to stop, right? But it's ultimately your decision. Okay? Our food is definitely toxic today. Would you guys agree? I mean, come on. It's bad. I could do a whole 3-hour seminar on that. Did you know your house is probably toxic? Give me an example of a toxin that's found in your house.
Cleaners.
Could be carpets, cleaners, but there's a big one that really affects your thyroid that most of us don't realize is in our house. It starts with an M. Huh? Mold. Mold. Big deal for your thyroid. Mold. Heavy metals. And our mom, right? Like, what the heck? Now, here's something huge. If you've ever been told that your issue is genetic and that you have what you have because your parents had that, and their parents had that, and their parents had that, guess where we inherit our toxic load? From our mom. Why not our dad? Why do we get it from our mom and not our dad? Don't answer, because you guys should be able to answer. Why do we get it from our mom and not our dad? What's that? The mom carries both male and female. The dad doesn't do anything. It helps a little bit, but that's it. Whatever mom's toxicity issue is transferred to the child. Now watch. If mom had a thyroid issue because of heavy metals, the child will absorb the heavy metals, will develop and start to have heavy metal toxicity, but why aren't they born with a thyroid issue? They haven't lived long enough to have the whole system fail apart. It's not that they're not exposed, it's that they haven't been around long enough. Now, are we seeing kids have adult diseases today? That's why. We're getting toxic and more toxic and more toxic and more toxic. I hate to say it, but mom gives you your toxicity. And that's the connection to why your parents had the same issue. It is not your DNA. It is not your genes. It's the toxins. You can turn off your genes if you clean out your toxins. Isn't that cool? So I have diabetic genes inside of me. I have heart disease genes. I have cancer genes. My whole family has all kinds of health issues. But I turn them off by getting my toxicity low. Okay? So I don't know if you guys have noticed this or not, but even the stats say that drug overdoses, and this is medical drug overdoses, not heroin, cocaine, crack, all that sort of stuff. It's like, oops, I took a Xanax with a sleeping pill, and I died. Okay? How many more are that than car accidents, guns, and falling? Isn't the government trying to get rid of these things right now because they say those are killing everybody? Why aren't they getting rid of the medications? Lots of money behind that, right? There's MDs even saying we are overprescribed, we're causing problems, we take too many pills, we take way too much medications, and then there's the foods that we eat that are also very toxic. Okay, I don't think you guys need to know what a good food is and what a bad food is, right? Okay, do we need to practice? Okay, I have a Pop-Tart and I have an apple. I have a piece of chocolate cake and I have a carrot, which, like, it's pretty easy, isn't it? Okay, so make a decision to eat real food. How do you know if food is real? It wasn't made by a human being. It doesn't come in a box. Real food does not come inside of a box. Do you agree? Well, it says it's organic and it says it's BPA free and it says it's still not real food. You guys got it? If it has a barcode on it or it's in a box, it's not real. It's not real. Okay? 95% of all chronic diseases have been connected to your choice. Not the food itself, but to your choice, which is your decision, which means you get to decide if your food is healing you or if it is killing you. The problem is most of us eat based upon what? What makes us feel good. I heard somebody when I was here this morning talking about hot dogs, right? Oh, the best hot dog is to eat it this way. Where do hot dogs come from? Leftover bits and pieces of pork and or other based products. It is not a naturally occurring food. Should you eat hot dogs? No. Oh, but I love them, Doc. They're so good. That's your decision, man. I don't touch them with a 10-foot pole. No way. Also because that is what? Wheat, and wheat causes leaky gut, and leaky gut causes health issues. So if I want to get healthy again, I need to clean out my diet. Right. Make sense? If you can help, I can help you with it. Here's the household stuff, right? Now, you guys might say to me, I do not eat that stuff. I definitely don't eat it. But you do. Did you know that? You do. If you wash your pots and pans with this, do you get it all off? No. There's a thin residue that always stays behind. Your food will absorb it. If you wipe your counter with this and you clean it off, is it just all of a sudden it disappears when it's dried? No. So if you cook or eat or touch or anything with that, you know what? They, in my daughter's school, wipe all the toys with that. And the moment I saw them do that, I said, we are getting out of this school. We're not going to school anymore. And then everybody thought we were nuts. Now she goes to another school, and it's progressive, it's green, and they don't do this kind of stuff. How am I eating this? How do I eat the Tide stuff? Yeah, bingo, right? If I wash this in Tide, it's still on here even when it's dry. And I don't know about you, but your skin can absorb things, can it not? Yes, it can, so be very careful. Our toxicities are everywhere, right? If I put any of those into here, what would happen to this guy? So when you put them into you, it does the same thing. I'm not trying to like doom and gloom you. Clean out your house, detox your body, pull the toxins out. It's one layer of interference. Now, what if you're like, I'm a vegan, I live in a greenhouse. In fact, I live in the woods in a tree house. There's nothing but raw nature. Again, I eat dirt and bark and nuts and twigs and whatever. And I have no toxicity. Could I still have a health issue? Yes, my spine could be out of alignment or I could have a gut problem. More than likely, that person would have a spinal issue because their gut would be hopefully pretty clean. Does that make sense? That's why there's three. You might actually have one of the three or you might have all of the three. Mercury is a big deal, guys. If you have this in your mouth, I promise you it's causing a problem with your body. Now, the moment I say go to your dentist and have them take it out, what do you start thinking? Oh, it's so much money. Oh, watch out for it. Watch out for it. What's more important, your money in your account or your health for the rest of your life? You guys got to decide. I can't tell you. You have to decide, right? How much does it cost to take one amalgam filling out and replace it with a ceramic? Several $1,000s on average. So if you have 6, 8, 10 of these, you could be looking at $20,000 to $30,000 investments. Do they do it in one setting? No. But if you get 3 out, you're better than if you had those 3 in, okay? The problem here is this. Did you know that holistically, each tooth in your body is a direct reflection of the organs associated with the tooth? Did you know this? Each tooth tells you about your body on the inside. So if you're like, oh man, I got this cavity here, it then cracked, the root's decaying, it means the organ is shutting down. If you have really strong teeth, you have really good organs. Did you know your mouth is the window to your health? Have you guys heard of this? So what they've now discovered is that every tooth has a specific one. Now, which one is the thyroid? Okay? It is your third tooth, wisdom, and then the back one and this one. Out of curiosity, Who has a filling in that tooth right now? Okay, so 1, 2, 1, 2 on either side because it's on both sides. Upper second left, upper second right. It's 90% chance if your thyroid's out, you have one there, right? So if you really want to fix your thyroid and we want to get rid of toxicity, what do we have to do? You don't necessarily have to remove them all. Definitely get the thyroid one replaced. Does that make sense? But then you might go, well, what about my thymus? That's kind of important too, right? What about my posterior pituitary that's involved in my... This is where everybody gets fillings, don't they? The top last three, or the bottom last three. What does this go to? Stomach, esophagus, lung, breast, testicular, right? I hope you guys can connect the dots. Okay? Mercury toxicity has the symptoms that spell exactly hypothyroid, doesn't it? Depression, fatigue, anxiety, forgetfulness, eyelid or muscle twitching, digestive issues, constipation, dizziness, irritability. Do you guys see it? It's the exact same symptoms as low thyroid. So why do you think they don't test for this? Why wouldn't they check you for how much mercury is in your body? Do you guys know? Why won't a medical doctor say, you know what? We should run a heavy metal test on you to find out if there's too many toxins in your body from heavy metals. Why don't they do that? Can't fix it. There's no drug that will get rid of heavy metal toxins, so they will never, ever test you for it. Okay? Lead causes a lot of the same things, doesn't it? Very similar pattern. Abdominal pain, constipation, difficulty sleeping, irritability. I lose the ability to feel things. Lead and mercury are the two big ones. This is my wife's heavy metal test. Whoo! Lead through the roof. This is my heavy metal test. Whoo! Almost mirror image. Where did we get the lead from? Where did we get the lead from? Mom. Because my mom grew up in the lead generation, where lead was everywhere, right? You guys remember leaded gasoline? Okay, do you remember leaded paints? Lead everywhere? I guarantee you, you have lead in your body, and it might be what's holding you back. Might be what's holding you back. So, are we ready for a review? Drum roll, please. I'm doing phenomenal. According to my watch, I only have 6 minutes until it's 1 o'clock. So, like, this is like a world record for me. You guys don't understand. Like, my staff are going like, wow. Because normally I go, and they're over here like this. Stop! You're killing everybody. Okay, watch. What are the 3 causes of all thyroid conditions? Somebody help me with them. 3 causes of thyroid conditions. Cause number 1, leaky gut. Cause number 2. Good. Okay. They also then cause all health issues. So it's not just thyroid, it's everything. Does that make sense? I don't even know why I did that because you can't even read it. How do we test for a leaky gut? Let them. Fat where?
In the abdomen.
And how would you know how much fat's in your abdomen? Could you just look down and go, oh yeah, more than 50? You could. But what if you're like this? Could you still have more than 50% of fat in here? Yes. So you have to get what? A body composition scan. It's a special scale. Guys, this scale costs like 10 grand. Okay? You stand on it, you hold it, and it runs a small current. You won't feel it at all. You'll just hop off, and then it'll go ping, and then I can tell you if you have it or not. Best test on the planet. Best test on the planet. How do we test for toxicities? The blood test. Yeah, we look for them. How do we check for neurological involvement? X-rays. Not chiropractic and not medical. Very special X-rays. Does that make sense? What are the triggers for thyroid conditions? Well, we could irritate ourselves by making these guys worse. What could trigger your gut and make it worse? Your diet. What could trigger your toxins and make them worse? Medications, heavy metals. You guys remember the 5 things? Blah, blah, blah. Yes, as well, right? What would make our spine worse? I didn't really talk about this that much. What makes our spine out of alignment in the first place? The way we sit. But worse than the way we sit is the way we sleep. Okay? Real quick, ready? Let me see if I can do this for you guys. Remember I said there's supposed to be a curve in your neck? You guys remember that? So you want a curve in your neck. So I'm going to draw a bed. Okay? We're looking at it from the side. This is footboard. This is headboard. Everybody got the analogy? So footboard, headboard, they're usually bigger. Okay? If your feet are here, and your knees are here, and your hips are here, and your shoulders are here, what do we do at night? We put a pillow right here, don't we? And we make our neck go like that. And what does that do to our neck? goes. Now, this is going to sound crazy, isn't it? Don't sleep with a pillow, because you are designed to have your neck be in alignment with your body. Now, the moment I say that, what do you guys say to me? No way, I can't do it. Right? The reason you can't is you've gotten so used to it, but you're actually causing health issues as a result. Okay? Now, someone says to me once, they're like, what about side sleeping? Okay, well then you better make sure that what? If you're facing us this way, that it is all in perfect alignment, which means you do need something to support your head to keep it in alignment with the rest. So we should use a pillow when we side sleep. But now, did you know this? Not everybody's distance between their neck and their shoulders are the same. So you need a custom pillow made just for you to keep you in line. Because if you sleep like this, which you all do, are you causing nerve impressions and damage to? Yes. How do we find out how much you have and how long it's been there? X-ray. So can you trigger your conditions by doing day-to-day life? What else causes stress to our spine? Everything. Would you agree? I don't know about you, but like working at a computer, you're like, oh God, it's like on fire back here. But what we do is we go get a massage, it feels good, and we go, oh, I'm good. What if it's a major, major problem that you're not aware of until later on? When you blow a disc out on your neck, you're going to go like this. Oh, my neck, fix. But when it's straight, you're going to not feel it at all. Get tested. Please, I encourage you to get tested. Even if you don't do it with me, do it with someone. Get tested. Does that make sense? And what is the best thing that you can do to reverse and prevent any form of disease in your body? Fix the cause. Whoops. That's part of it. Fix the cause, right? Go after the gut, go after your toxins, clean out your nerve system. Are you guys okay with this? Like, I'm getting this sensation that you're almost like, okay, just shut up, I'm ready to go. I don't know what it is. Something's going on. Can you tell me? Is it overwhelmed? Is it overloaded? We're a little tired. That's the thyroid though, right? The fatigue, right? Do you want to fix it?
Yeah.
Then all we have to do is find out if I can test you. Who gets to decide? You do, okay? So why don't we do this then? That little sheet that I showed you guys before, the little half sheet, right? If you want to get tested by me, all I ask you do is fill out name, phone number, some information. I do need date of birth because you're going into my database, right? It's a medical database. It won't let us push save unless there's a date of birth there. Everybody got that? And then all I ask you to do is to circle a time that you would be like, you know, I think I might want to do this. I actually might go to your office, and on Tuesday at 3:30, I would like to be fully evaluated. What do we evaluate? We evaluate your spine. We evaluate your gut, we evaluate your toxicity, and because it's thyroid, I'm giving you guys that full functional thyroid panel included for the $400 discounted price of $497 instead of $897. You guys with me on that? Now, look up at me real quick. That lab test cost me $497 to run. So I'm giving you the cost that what they charge me. It retails between $800 and $900. Just for that blood test for me to see what your thyroid is doing. So what I'm doing is this. If you want to do this, I will give you several things. 1, the test of your blood. 2, the full evaluation, nerve, gut, spine, all of it. Everybody with me on that? That is visit number 1. Everybody good? On visit number 2 then, you will come back 30 minutes and we will review the results of visit number 1. Make sense? And then I will tell you, please do X, Y, or Z, and I'd like to have you then come back and let's see how you reacted. If you need your nerves corrected, we will do an adjustment, retest before and after, and then go over those results on your 3rd visit and go, look at the nerve, it opened. How did you do with your nutrition test? What happened when you did what I asked you to do? I had this last week. This woman comes to me, she goes, I lost 7 pounds in 4 days. How do I start right now? Like, it's amazing what happens when you guys become your own doctors, right? All I do is coach and teach you what to do, okay? So what you get is 1st visit with the blood test, 2nd visit, 30 minutes to go over the results, have me show you what to do, 3rd visit, 1 hour for me to say, look, if I was you, I would go get this. I would fix this, do this, correct this, and if you want me to help you with it, here's what I can do. Your insurance is going to say, here's the price, and dependent upon how much care you need, we knock it down 50, 60, 70%. Does that make sense? Mm-hmm. Now, everybody, I know you're filling forms out. Look up at me. I'm going to do something very special, though. If we get to the 3rd visit and you say, yes, man, I'm all over it, the $497 that you invested, I will credit to whatever the cost of your insurance or whatever your out-of-pocket fees are. So in the end, what did you get? The whole thing for free. Okay? I only do that, though, if you chat with them, you pre-schedule your appointment today, and you say, I'm all over this. Now, if you call me tomorrow and you say, can I do the special? Yes, you can. And I'm not trying to make this to be like a little enticement, okay? But then I'm not going to recredit it back, because what did you do today? You made a decision. You guys got it? Please decide. If you need like 5 minutes just to sit here and pray and ask God, should I do this? His answer is going to be like, of course you should do something for your health. I've never heard him say don't, okay? You guys decide today. I ask you, okay, literally, if you're like, I do not want to do this, great! It's your decision. Go, have fun. Come to my seminars, come to my dinners, do whatever you want. But if you want to do this, please, I beg of you, fill it out, choose your times, and then do this, because I see some of you, like you, great, right? You've circled a time. I'm not going to tell everybody else because they might fight you for this time. But please circle two times, and put a star next to the one that you want, and put a circle around the second option, because I don't know that that time is going to be absolutely available for you. Is that fair? Now, my team is over here, right? We have Tom Kershaw. How many of you got calls, texts, voicemails, Facebook messages, and everything from Tom? Tom is like a rock star, is he not? His job is to make sure that all of your questions are answered as regards to events. He puts these on. He's my videographer. Can we give a round of applause for Tom? Works his butt to the bone for us. Thank you, Tom. And then we have Angela. Can Angela wave? You guys met her briefly, my clinical assistant. And this is Kelly. She works at our front desk. She is the master scheduler. She manages every single person I work with, and I honestly don't even know how she does it. That's her gifting, right? So if you want to do this, all you have to do is you stand up, you go over to that little area. They're going to pull that little thing behind so you guys can get to it. Talk with Angela, talk with them, find a time. Does that make sense? Are we guys okay with that? Like, that's why I came here today, to see if you want help. Are we good? Are we good? Did you guys have fun?
Yes.
Okay. I don't know that I have much else other than what I just described to you guys. So I tell you what, because we're like, super duper on time, talk to them first. I'm going to go out into the lobby because I got to take care of one thing real quick with the hotel. But I will stay for 5 minutes, and that's it, because then I got to run down to my radio show. Make sure you guys listen today. It's phenomenal. I don't want to give the topic away because you're going to love it. So it's 3 o'clock, 11:10 a.m. Listen, I'll give it away. It's about toxicity and detoxing, right? But it's nothing like you guys just learned today, okay? So chat with my crew, and we'll have fun from there. Are we good?
Yes.
Great. Thanks so much, guys.